screen?
It looks wonderful.
Thank you. So thank you very much for the invitation. It's my pleasure to be here, and it's my pleasure to discuss something that is a little bit different of what most of the meeting about CLL discuss. Most of the times with chronic lymphocytic leukemia, we talk about treatment, treatment side effects, treatment options. Instead, this time today, we're going to talk about survivorship. I think the concept of survivorship is very important. Based on the National Cancer Institute definition, anybody diagnosed with CLL is a cancer survivor from the first day of the diagnosis until the last day of life. And there is an increasing interest in really providing what I call a global approach to survivorship. And this, to me, applies to chronic lymphocytic leukemia really to a greater extent, because this is a disease that is very unique. This is probably the only type of cancer when somebody may be told, yes, you have chronic lymphocytic leukemia, you have CLL, is a leukemia, but we're going to observe you. So, and this is also a disease where for many, many people, we can tell them that their life expectation, their life expectancy, the time that they will live, is not really affected by this disease. So whereas we have a lot to talk about treatment, I think this is a disease where we have as much to talk about survivorship. And what survivorship encompasses is a lot of different aspects of our daily life. And exercise, nutrition, and fatigue are definitely part of these aspects. Many of my patients will come to me and they will say, you know, I have a lot of fatigue. At a certain time of the day, I'm exhausted. I need to take a nap to continue going on, or I've changed my lifestyle and I've given up things that bring me a lot of pleasure because I'm too tired to do it. So from very early in my career, I started looking into it, and I can share that, interestingly, fatigue seemed to be common regardless of the extent of CLL. Sometimes some patients will come to me, they have a disease that is really what we consider very how can I say, very early. They may be RISE stage 0. There is just a little bit of CLL that you can find, but the amount of fatigue that is present is significant. And we have noticed that at times, fatigue is the reason why treatment is started. And often, treatment can improve the level of fatigue. But we have also looked at other ways to reduce the level of fatigue. Some of those could be pharmacological, but like, for example, starting medication similar to what people take if they have an attention deficit disorder. But as we all know, a medication comes with side effects, comes with risks. So what we have explored is that sometimes life changes, such as an exercise program, can really help reducing the level of fatigue and kind of breaking this cycle of being tired, not wanting to exercise, and therefore being more tired. However, beside some I would say obvious aspects such as stop smoking, and there is very little known of how to approach this topic. And therefore, we started looking into how to approach and create a program with a healthy diet and exercise that is specifically tailored for patients with CLL and how to optimize this program. As I said, there was not much reported in the literature, so our first study, the Health for CLL study, that has been published last year, was really an exploration study where in our methods, we tested in collaboration with a center at MD Anderson that is called Center for Energy Balance, and with a multidisciplinary team composed of nutritionists, exercise physiologists, and PhD that are exercise scientists, we explore 16 different combinations of different type of interventions. Those were a mix of telephone, email coaching. We also use text message reminders. We look at different type of exercise, aerobic exercise versus resistant exercise. We look at different frequency for this exercise, once a week, twice a week. And what we did, our strategy included giving our participant a Fitbit, that is a wearable device. Most of you may be familiar with it, that records our steps, our physical activity, and other parameters, as well as diet advice. So we wanted to also see how people that have CLL, but also have other conditions, we all have other conditions, and we call them comorbidities, affect the ability to have an impact on the fatigue. And then what I find extremely important is that through exercise science, we know that the benefit of exercise go beyond having just being fit, having a better muscle. They really exercise has an impact on our immune system. Exercise has an impact on the function of our neutrophil cells, has an impact of the function of our T cells that are a different type of lymphocytes than the one that are involved by the CLL, and that they are very important for our immune system. And again, we feel that somebody that has CLL, therefore has the immunocompromise that comes from CLL, really had the potential of benefit by this type of interventions. So actually, our theory was proven correct, because when we look at those graphs, we can see how the fatigue score that is measured through different fairly complex scoring system, such as the FACT fatigue and the PROMIS fatigue, improved once the exercise program was completed. We also saw that patients lost some weight. So their ideal body weight became closer to what their body weight became closer to an ideal body weight, thanks to the strategies of exercise and diet advice. Those are additional tests that also show at a statistical significance how some of those exercise were improved, like we saw improve in the ability of performing arm curls, improve in the ability of grip, improve in the ability of doing a 6 minutes walk, and speed of getting up and go. Many of these aspects improve to a statistical significance level, and this was very rewarding to us. But we also had some blood drawn, that where blood was taken at the time of the exercise. And this is where we really found something that is at least to me, fascinating. We found, just to say in fairly simple word, that patients, people with CLL and more comorbidity, such as cardiovascular disease, hypertension, increased lipid levels, and other chronic condition, they actually, the one with what we call the high comorbidity score, had even more impairment in their T cell functions. That is, again, a measurement of their immune response. However, they were also the one that had the most benefit in their T cell function with exercise. So basically, this tells us that people that have CLL that maybe have more comorbidity and therefore they may have the tendency to be more sedentary and possibly maybe have more of a tendency to be overweight really benefit from a program like ours. And this was very, very rewarding. So what we did, we decided that since we had now started exploring this very little explore field, and we were able to demonstrate that patients with CLR are capable to increase their activity despite, tending to be sometimes older and having some fatigue. And we found the best mix of coaching, self-monitoring, and reminder. We realized that having a program that is all virtual, after we often do an in-person teaching section, is what is more easy to apply to people anywhere they are. We also noticed, and we got really feedback, positive feedback by our participants, that they said that they not only improve their physical activity and improve their eating habits during the study, but those kind of stick on. They were able to keep those good habits over time. We therefore, and we have seen the benefits of this intervention on the immune system. We developed a new program that is now ongoing. So I'm doing a little bit of advertisement. It's called Health for CLL 2, where we took our most successful strategies and we incorporated this in a program that we are now offering. And we are offering this program to people with CLL, whether they are receiving treatment or they could be on observation. And regardless of whether there is a low level of comorbidity or a high level of comorbidity, we are accompanying it with even more sophisticated studies of the immune system. We are also checking changes in the change in diet on the intestine microbiome, the gut microbiome, that is the microbial composition of our intestine. And as far as the diet that we use, I don't want people to be scared. We really don't expect a strict diet, but we do follow American Diabetic Association recommendation for what is considered a complete diet. So this is the experience that we have at our center. And again, I would like to thank you, Dalton, and the whole community for the opportunity to share what we are doing with you.
Thank you for that. And I'm sure we'll have some questions here, but that was a super interesting presentation. And I love being able to see the data. I think everyone knows that exercise and eating healthy generally makes you feel a little bit better, but I love being able to see the data that really backs those claims up. So thank you for sharing those slides. I found it very helpful. Um, So now is our time for Q&A. So if you have any questions for Dr. Ferrajoli, feel free to drop them in the chat. If you'd like to ask them verbally, you can also unmute yourself. Looks like we may have one in here right now. Yeah, so I think this is a great one. Is the Health for CLL study open to people? And if so, how can we get involved?
So it's open right now is through our CLL survivorship clinic. Again, our CLL survivorship clinic is a clinic that I have the pleasure of directing at MD Anderson, looks at different, aspects of survivorship, including immunization, cancer screening, mental health. And one of the things that we offer is this study, the Health for CLL study. Right now, has been all participants have been patients at our center, so the only condition that you have will be to somehow, schedule a visit to see us in Houston. And after an initial visit, though, the rest of the program is all virtual. And if you are somebody that has already been seen at our center before, the entire program can be virtual. But because of technicalities and now we need to evaluate the patients for the program, we do have people to be established at our center.
Okay, that makes sense. And it's really nice that once they do establish at the center, that they can be virtual. So if someone isn't in the Houston area, but is really interested in joining, they still do have that opportunity. I think that's
Correct.
wonderful.
Yes, thank
All
you.
right.
The first was in person, and we really wanted to make it virtual. And in this second, in Health for CLL2, we are able to do
I think that's wonderful. All right, next question up. Should we monitor our heart rate during exercise?
that.
1 second. I find that I cannot exercise as hard as I can or as I used to before I was diagnosed with CLL. What heart rate level would you recommend for us?
Okay, so first the disclaimer that I'm an oncologist and not a cardiologist or an exercise physiologist. However, this is a common, a common question that I have. I would say that for people that have a normal heart rate, I probably wouldn't go past an heart rate of 120 or 130 during exercise. We have really noted that an exercise to be beneficial doesn't need to be strenuous. But what needs to be, it needs to be regular and possibly 3 to 5 times a week for at least 30 to 45 minutes exercise. And I would say try to keep the heart rate within a reasonable range, maybe not the 120 or 130. However, if you are on a medication that reduces heart rate, then you need to keep that heart rate maybe a little bit less, even 110 or less, because you may be starting from a lower heart rate.
Okay. Right, next up, we have, do those of us around the country have access to the specific diet recommended for the Health for CLL studies? Or is it more of a just encouraging a healthy diet? This individual is looking for some more specific diet recommendations. So just could you point them in the direction for the diet that they might want to
Yes.
follow along with?
Yes, our diet is an adaptation of the American Diabetic Association diet for adults. So if you follow the American Diabetic Association diet for healthy adults, this will be, your model to follow. I can already tell you that our diet within this study really stresses on reducing the number of processed food and stressing the amount of, of food that is as fiber, food that has a good protein intake, and reduce the amount of intake of food that are rich of sugars.
All right. And we can try to send a link to that diet out in a
Yeah,
follow-up
yeah,
email as
definitely.
well.
We'll be happy. I can also send it to you. I don't have it on my
Wonderful.
screen.
Perfect. All right.
Yes.
And then next up, do you recommend more cardio or resistance exercise? Was that studied or is there a benefit to one or the other?
I recommend a mix of the two. However, it seems like resistant exercise has more benefits on fatigue, but I would say a good balance of both is important.
Okay.
But
And
resistant
then
exercise was particularly beneficial.
And then this next question, I'm not sure if this was covered in the study, but you may have some insight for it, or potentially another idea for a future study. But what benefits do you find for people on plant-based diets?
So this was not studied. We will see this because, as I mentioned, one of the additional tests we are doing is the intestinal microbiome, the gut microbiome. And when we record the type of diet that our participants are on, being on a plant-based diet will be noted. And once we read out this study, we may be able to see a difference between participants that are on a plant-based diet and the one that are not. I
Okay,
have to say that a very small amount of patients in my practice is on a plant-based diet.
that's good to note. And then I had a question here.
Yes.
So for the individuals in the audience who are saying, I hear you, I know that I need to exercise more, it'll make me feel better, but I'm just so tired. I can hardly think about standing to get up off the couch. How am I supposed to do an exercise routine? Do you have any tips for people on how to start exercising and implementing a little bit of this healthier lifestyle to help?
Sure, there are different strategies that I have found over the year to be successful. One will be doing an incremental exercise. For example, brisk walk. You can start with just 5 minutes for the first week, then you can increase it to 10 minutes, then you can increase it to 15 minutes, and you can find that to be an easier way to build up the ability to exercise. The second approach that is very helpful is sometimes to have a companion, to have a buddy, so that and doesn't have to be in person, can be virtual, can be somebody that is another CLL survivor, and that helps to keep each other accountable,
Mm.
and it tends to be successful. A third tip that I found is that if there is the option, maybe enrolling in a class. That can be, of course, a class that if you are a senior citizen should be a senior citizen class, or a class that is appropriate for your level of fitness. Another thing I've noticed is sometimes there are time constraints. People are very busy. So, for example, swimming is a very effective type of exercise because within a short period of time, you really do a lot of movements and you really get a lot of exercise with just like 15, 20 minutes of, just leisure swimming. You don't have to be a competitive swimmer. Sometimes also when there is availability, water aerobic classes are very helpful because there is at time the concern that, yes, I know I need to exercise, but my joints are, how can I say, not really willing to collaborate with my exercise wish and my exercise plan. So we need to remember that sometimes an exercise like water exercises is a lower impact type of exercise. I was at a meeting at a Canadian CLL patients meeting, and actually there were some very interesting tools that an exercise physiologist from Toronto was sharing. She was saying, let's say maybe you're watching a program and you can stand up and make a few steps every time there is an advertisement, or if you are at a, looking at any kind of a show, is really important whenever there is the opportunity to clap your hands, also stand up and move around. So those are really little tricks that we can incorporate in our life that can help us to be more active.
Yeah, those are great tricks, and I think a really good way to let people know that incremental increases are good. And I'm
Mhm.
guilty of being super bad about just laying on the couch and not getting up and doing anything. But if I were to get up and take a couple of steps every time a commercial comes on, I'm sure I'd be way more active, and over time that adds up.
Yeah. And now there is
So,
a lot of technology that helps us. We have a lot of wearable devices that really help us to keep track of many, components in our daily routine. I do try to walk the talk, so I do have regular exercise with a trainer, and I try to do at least 10,000 steps a day.
nice. And then we have a couple more questions in
Mhm.
here. Are there any specific foods that can help raise hemoglobin and red blood cells?
So, on a regular, for people that don't have a particular restriction in their diet, the majority of people will not have any deficiency in iron, any deficiency in vitamin B12, or any deficiency in folic acid. However, what I recommend, and we often do it at the evaluation of people with CLL at our center, I do recommend to check for your iron level, for your folic acid level, for your vitamin B12 level, and make sure that those are adequate. If they're not adequate, they can be supplemented. And if they are not adequate, especially, for example, uh, any men and women that are postmenopausal really do not have blood losses, so they shouldn't be deficient in iron. If they are deficient in iron, then there is an issue with either loss, that may be a loss that is so small but continuous that you cannot detect, or issues with absorption. And both of those can be investigated and they can be treated. Similarly, for folic acid or B12, our diet is normally provide us sufficient amount of those two vitamins, but similarly to what I said before, if there are issues with absorption, we may have levels that are suboptimal. I personally don't recommend taking an excess of vitamins. I feel that taking the 100% recommended daily dose is sufficient, because any excess of vitamins will then need to be processed by our body, needs to be eliminated. It could potentially interfere with medications, and so I do not recommend it routinely.
And I think that perfectly ties into the next question here of what supplements do you recommend? I prioritize exercise. I go to the gym most every weekday morning for a class. This individual's heard that they should be taking vitamin D. Are there any other supplements that you think could be beneficial for the CLL community?
So for the majority of the women, we really should take vitamin D and calcium to help with our bone health. So bone health is very important, and I do recommend to see an endocrinologist or rheumatologist or bone health specialist and do, bone scan to make sure that your bone health is appropriate and you follow it. Otherwise, I do recommend to take maybe a multivitamin a day to make sure you have 100% of the daily recommended levels of vitamins. There is some literature regarding other supplements, but unfortunately, it's not very clear and it's difficult to give uh, recommendation from it. There is a study that was done by the Mayo Clinic in Rochester that indicated that taking a something that is a derivative of green tea could be beneficial to patients with CLL, but the exact green tea product that they use is not, for the study, is not commercially available, and green tea is also associated with some possible side effects. Like all the teas tend to be acid, so it could cause some gastritis, and even the decaffeinated green tea can still have a small amount of caffeine, and as we know, caffeine can be having an effect on blood pressure and heart rate. Said that, I think it's perfectly fine if somebody likes green tea to drink a cup of green tea a day. There were some studies with curcumin. Curcumin is the same substance that is in curry that showed a potential effect on slowing the growth of the CLL cells. However, those were exclusively done in laboratory. So I don't really feel that I can make recommendation based on those laboratory studies. There was a study out, I think it was the University of Alabama, that showed that during the winter, ginseng extract could help possibly in preventing some of the, typically winter respiratory infections. So that's something that could be looked into it. The
Okay.
other recommendation, since we're talking about, lifestyle health, I do recommend for people with CLL to mask in certain situations, especially if they are in a crowded environment, especially in an environment where people speak and sing loudly facing each other. And I probably would recommend to mask when you are queuing at a bus station or at an airport, not necessarily when you are in the airplane, but yeah, those are just common sense um, recommendations that I can share.
I love getting any and all of the recommendations because these are questions that the community always has. So getting an answer to them is fantastic. All right. And then looks like we have one more question in here right now. And it's, are we prone to overuse injuries during exercise or even during daily activity? So just does CLL have a higher increase for overuse potential?
No,
No.
CLL does not.
All
It's
right.
sometimes what we see is that CLL tends to occur later in life, and especially if we were, had prior injuries or we had, we are heavily engaged in sports, then there could be some consequences later in life that maybe they can present at the same time as CLL. But no, the disease by itself does not predispose to injuries.
Okay. Well, I think that's the last of our questions. So thank you so much for this wonderful presentation and for answering all of these questions. It was truly such a joy to work with you.
Thank you, everyone, and everyone has a good rest of the afternoon and a good long weekend.
Yes, and you as well.
Thank you. Bye bye.
Bye.